So this is in continuation of my previous video wherein I get to see a lot of questions being asked about penile implants. So the next question being how to pee with a penile implant, which means a person has undergone a penile implant, how can he pass the urine with the penile implant being in place? So the urination will not get affected by the presence of a penile implant. Usually if you have a semi-rigid penile implant, just you need to direct it downwards when you are peeing. That is all that you need to do. If you are having an inflatable penile implant, you need to deflate the pump so that the cylinders get emptied and you have a relatively flaccid penis so that it will be easy for you to pass urine. So the presence of penile implant as such is not going to affect the way you pass the urine. Of course, if some elderly patients, they have a associated prostate issues, they can safely continue to take the prostate medications even though they have a penile implant. Yes, in the future, if somebody requires a prostate surgery like an endoscopic TURP or a laser prostate surgery, the surgery can be safely done even though the penile implant is in place. So the next question is, who is a candidate for penile implant? So which means, can anybody get a penile implant done? Yeah, so age is not a limit. We have seen as young as 25-year-olds who have got a penile implant, and we have seen as old as a 92-year-old guy who underwent a penile implant surgery because he had a 40-year-old wife. So age is just a number. As long as you want to be sexually active, you can undergo a penile implant surgery. But again, we assess which implant is better suited, whether semi-rigid or inflatable. So if somebody has mild hand tremors at an elderly age group, so we usually suggest them to undergo a semi-rigid penile implant because there is no any pump that they need to handle. Because in inflatable penile implant, they need to handle the pump to get an erection. So somebody who has tremors, they may not be able to handle this pump. And somebody who has undergone a kidney transplant surgery also can undergo a penile implant surgery. Of course, we usually recommend a semi-rigid penile implant or a 2-piece inflatable implant and not ideally a 3-piece inflatable implant in a patient who has undergone a kidney transplant surgery. So overall, any age person can undergo a penile implant surgery. So the third question being, how does a penile implant look like? Again, these are all the questions which the patients have asked online. So see, externally nobody can make out that there is an implant inside, but when your partner or when your wife touches the penis, definitely he or she can make out that there is some implant inside. And even though the inflatable penile implant has so many tubings, pump, reservoir, cylinders, nothing is seen outside. It is entirely, completely concealed inside the body. Can you play sports with a penile implant? Definitely yes. Somebody who is into sports, whether it is the semi-rigid or the inflatable penile implants, you can safely play any sport of your choice. It is not going to hinder the way you play your sports. Which is the cheapest penile implant? The cheapest penile implant would be the Indian semi-rigid penile implant. So to answer in simple words, if somebody says, doc, suggest me a most safest penile implant, that would be a semi-rigid penile implant. If somebody asks me, doc, please suggest me an implant which gives me more satisfaction to myself and to my wife, then the inflatable penile implant would be a better choice. These are some of the common questions that we get online.